The AI PERT workflow has dramatically improved our team's awareness of patient flow and volume because we'll talk about the kind of system we had before we had AI. But we would essentially rely on us getting consultations from the primary teams. But now we get information about these PEs directly. So we're pretty aware of what the volume and the flow is. And it has facilitated very close collaboration between various specialty members because all of us have access to this app and we're all getting the notification at the same time. So even before I call Jonathan for a case, he's already aware about the case and he knows that, I'm doing this procedure, maybe I need to triage this patient a little bit earlier. And it has definitely enabled us to have more careful and comprehensive data collection. So I thought it would be essential to kind of talk about why we really care about PE. This is from a publication in 2016 by Beccattini. And it really highlights how we think about PEs. So, when we're talking about PEs, we're really putting them into these boxes. And we have unified this verbiage so that when we talk to each other, we know how critical this patient is. So patients would be either low risk, intermediate low risk, intermediate high risk, or high risk. And as you can see in the table, the death due to PE at 30 days is 15.2% with high risk. With intermediate high risk is 4.8%, intermediate low risk is 2.1%, and low risk is 0.5%. So even though it looks like it's 2.1% and 4.8%, that's a pretty significant number. And as a community, we've been striving to get these numbers down. And as we delve into our cases that we're going to be talking about, we're going to realize that there are a lot of factors that that cause these high mortalities. Awareness about the disease, access of care, delivery of care are huge components of this. And how artificial intelligence assists us to get to our target to decrease these mortality is very important.